Hello and welcome to Medical Dialogues. I'm Roshni and today I'll be talking about an interesting case. World's first reported case of Rhodoturula infection coupled with CMV meningitis in a 2-month-old infant was successfully treated by a team of doctors at Fortis Noida. This is the second reported case of CMV meningitis diagnosed via Biofire in the world as per the available medical records. The team of doctors led by Dr Ashutosh Sinha adopted the correct line of treatment, post-detailed medical evaluation, and timely diagnosis of the rare reported medical conditions. To talk to us in detail about the procedure, we have with us on board today Dr Ashutosh Sinha, Director and Head Paediatrics, Fortis Noida. Welcome to Medical Dialogues, Doctor.
Thank you.
So, Doctor, can you explain about the case, the symptoms, history, and what were the complications?
Right. So I'll tell you in brief about the history and what we did and what we found. So this child was 2 months old when came to us, and he came to us with high fever, and he was having regular fits. Fits means he was having seizures or shaking of the body in general terms. We initially did the initial investigations and treated it like a meningitis. Meningitis means brain fever. So we were treating with antibiotics, and we were hoping that it should get better. And then once the seizures slightly got better, we did some more tests, like sent off the CSF from the back of bone, back of the spine. We took some fluids and sent to the lab, and there it came back as initial report as meningitis. Although the cultures from the CSF were negative for any bacteria, but the initial microbiology picture looked like bacterial meningitis with high cell counts, high proteins, and low glucose level. And so we were treating with antibiotics, but his seizures were getting worse. So in between, we had to put him under coma on ventilator to control the seizures. And then once the seizures got better, we took him off the ventilator. And we were monitoring his fever. His fever was not getting better, and his CRP, which is a marker of infection, was also initially got better, and then it increased. So we sent off the CSF sample again so we repeated the sample, and we sent it for a Biofire test. Now, Biofire test is a special test which looks into different pathogens like bacteria, viruses, fungus as a whole. So there, everything was negative except CMV, which is a virus, cytomegalovirus. So what we did was, and it surprised us, because cytomegalovirus is very, very uncommon in babies, particularly the CMV meningitis, because it was involving the brain, because the sample was taken from CSF. So it came back as positive. So it indicated that he had a CMV meningitis. So now CMV meningitis treatment, and then why this CMV meningitis happened in these children. So that perplexed us. So we did a detailed investigation in terms of his immunity, because normally whatever cases have been reported or has been seen is more commonly in HIV patients or someone whose immunity is compromised, like someone who is on chemotherapy or who has got a cancer. In those patients, particularly elderly patients or grown-up patients, you get CMV meningitis. So we did a detailed investigation, but could not find any evidence of immunodeficiency or HIV. In fact, for the immune workup, we referred him to the other hospital reference labs, and it also came back as nothing significant there. So, but anyway, we had to treat CMV meningitis because his fever was not getting better. Although he was clinically okay, he was not very sick by then, but he had to be treated. So we started him with IV ganciclovir. Now, this medicine itself is a toxic medicine with a lot of side effects, and the duration of treatment was 6 weeks. Had to be given for 6 weeks, and that too IV. So that was a big challenge to give IV medication in a 2-month-old baby for 6 weeks, or which is 1.5 months. So and getting a cannula and central line in these children is posed with risk of recurrent infections from the lines itself. So I had a discussion with our onco-surgeon, and we decided to get a tunnel line. So tunnel line is something which is used in cancer patients to get chemotherapy, and this line is actually through the skin into one of the big blood vessels, and it is a safer line in terms of infections because the risk of infection in these lines are significantly less, and we can use these lines for a long period of time. So we gave ganciclovir through this, but even after a week or so of giving ganciclovir, his fever was not getting better. Initially, it got a little better, but again, it was not getting better. So we sent off the CSF culture that we had to look for fungus, and it came back as Rhodoturus yeast. So which was again surprised us because CMV with Rhodoturus has not been reported anywhere in the world that we know of. And treatment with Rhodoturus, yes, again this fungus is found in those patients who have HIV or who are on chemotherapies, immunosuppressed, those profile of patients. But this child was nowhere immune deficit. But again, we treated Rhodoturus with amphotericin B for 4 weeks for a month. So this total treatment went on for 1.5 months. And this child was with us for 2 months. And after 2 months of stay, we discharged him. And before discharging, we checked for these virus and fungus again, and it was all negative in his samples. And the good point is he was neurologically in a good shape. So his initial MRI showed some changes of meningitis, and the further MRI that we repeated, there was improvement in MRI. And his neurological development and milestones, we have been following him through, and he's 6-month-old now, and he is pretty much like a normal child. We have done hearing assessment, eye, vision assessment as well. These are all fine at the moment. But we'll be following this child closely because there's always a chance that they might lag behind later. So those things we will be monitoring closely.
Right. So, doctor, what are the prognosis? And as you said, he is well now, but any chance of complications in future?
Now, at the moment, what we are focusing on how he is at the present, and we will be following according to the protocol, like every few months for next few years. The expectation is we all hope that he stays completely normal and he develops normal. But whenever there is a CMV meningitis or any fungal infection of the brain or any meningitis, then there is a chance that there might be some delay in the development or cognitive abilities are compromised. So these things we'll have to observe, and this will come out more after follow-ups. But at the moment, for a 6-month-old child, he's doing absolutely everything that a 6-month-old child should do.
Very well, right, sir. Thank you, doctor. Thank you for your insights.
My pleasure. Thank you.
The case was managed extremely well with tremendous efficiency and expertise of Dr. Ashutosh and his team. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.